This is the Wikipedia page for SARS-CoV-2 Omicron Variant, Part 4 of 4. You're listening to the podcast where we read Wikipedia articles every day and provide commentary. If you like what you hear, please subscribe and consider donating at patreon.com/WikiListen podcast so we can continue to create this show. You can find us on social media at WikiListen and at WikiListen.com. Welcome to WikiListen. I'm Victor Varnado, KSN.
And I'm Rachel Teichman, LMSW.
This article needs more medical references for verification or relies too heavily on primary sources. For the latest information about the Omicron variant, check out the CDC's website at cdc.gov. History. A December 2021 article in Science observes Omicron did not evolve from any other variant of note, but instead on a distinct track diverging in perhaps mid-2020. The article expounds on three theories that might explain the surprising genetic lineage.
1. The virus could have circulated and evolved in a population with little surveillance and sequencing.
2. It could have gestated in a chronically infected COVID-19 patient.
3. It might have evolved in a non-human species from which it recently spilled back into people.
Whoa! That again? Is that a theory? I don't know. We'll see. Reported cases. On the 24th of November 2021, the variant was first reported by the World Health Organization from South Africa based on samples that had been collected from 14th to 16th of November. South African scientists were first alerted by samples from the very beginning of November where the PCR test had S-gene target failure. Occurs in a few variants, but not in Delta, which dominated in the country in October, and by a sudden increase of COVID-19 cases in Gauteng. Sequencing revealed that more than 70% of sample collected in the province between the 14th and 23rd of November were a new variant. The first confirmed specimens of Omicron were collected on the 8th of November 2021 in South Africa and on 9th of November in Botswana. Likely, Omicron SGTF samples had occurred on the 4th of November 2021 in Pretoria, South Africa.
When WHO was alerted on 24 November, Hong Kong was the only place outside Africa that had confirmed a case of Omicron. One person who traveled from South Africa on 11 November and another traveler who was cross-infected by this case while staying in the same quarantine hotel.
Yikes.
Oh no.
Yeah. On the 25th of November, one confirmed case was identified in Israel from a traveler returning from Malawi, allowing with two who returned from South Africa and one from Madagascar. All four initial cases reported from Botswana occurred among fully vaccinated individuals.
On 26 November, Belgium confirmed its first case, an unvaccinated person who had traveled from Egypt via Turkey on 11 November. All three initial confirmed and suspected cases reported from Israel occurred among fully vaccinated individuals, as did a single suspected case in Germany.
On the 27th of November, two cases were detected in the United Kingdom, another two in Munich, Germany, and one in Milan, Italy.
On 28 November, 13 cases were confirmed in the Netherlands among the 624 airline passengers who arrived from South Africa on 26 November. Confirmation of a further 5 cases among these passengers followed later. Entry into the Netherlands generally required having been vaccinated or PCR tested or having recovered. The passengers of these 2 flights had been tested upon arrival because of the newly imposed restrictions which were set in place during their flight. God. After which 61 tested positive for SARS-CoV-2. A further 2 cases were detected in Australia. Both people landed in Sydney the previous day and traveled from Southern Africa to Sydney Airport via Doha Airport. The 2 people who were fully vaccinated entered isolation. 12 other travelers from Southern Africa also entered quarantine for 14 days, while about 260 other passengers and crew on the flight have been directed to isolate. 2 travelers from South Africa who landed in Denmark tested positive for COVID-19, It was confirmed on 28 November that both carried the Omicron variant. On the same day, Austria also confirmed its first Omicron case. A detected Omicron case was reported in the Czech Republic from a traveler who spent time in Namibia. Canada also reported its first Omicron cases with 2 travelers from Nigeria, therefore becoming the first North American country to report an Omicron case.
On the 29th of November, a positive case was recorded in Darwin, Australia. The person arrived in Darwin on a repatriation flight from Johannesburg, South Africa on the 25th of November and was taken to a quarantine facility where the positive test was recorded. 2 more people who traveled to Sydney from Southern Africa via Singapore tested positive. Portugal reported 13 Omicron cases, all of them members of a soccer club. Sweden also confirmed their first case on the 29th of November, as did Spain when a traveler came from South Africa.
On 30 November, the Netherlands reported that Omicron cases had been detected in 2 samples dating back as early as 19 November. A positive case was recorded in Sydney from a traveler who had visited Southern Africa before travel restrictions were imposed and was subsequently active in the community. Japan also confirmed its first case. 2 Israeli doctors have tested positive and have entered isolation. Both of them had received 3 shots of the Pfizer vaccine prior to testing positive. In Brazil, 3 cases of the Omicron variant were confirmed in Sao Paulo. Another 5 are under suspicion. A person in Leipzig, Germany, with no travel history nor contact with travelers tested positive for Omicron.
That's crazy.
Yeah.
On the 1st of December, the Omicron variant was detected in 3 samples in Nigeria that had been collected from travelers from South Africa within the last week. On the same day, public health authorities in the United States announced the country's first confirmed Omicron case. A resident of San Francisco who had been vaccinated returned from South Africa on the 22nd of November, began showing mild symptoms on the 25th of November, and was confirmed to have a mild case of COVID-19 on the 29th of November. Ireland and South Korea also reported their first case. South Korea reported its cases from 5 travelers arriving in South Korea from Nigeria.
On 2 December, Dutch health authorities confirmed that all 14 passengers with confirmed Omicron infection on 26 November had been previously vaccinated. The same day, the Norwegian Institute of Public Health confirmed that 50 attendees of a company Christmas party held at a restaurant in Norway's capital, Oslo, were infected with the Omicron variant. France has confirmed only 25 cases of the new Omicron variant, but officials say the number could jump significantly in the coming weeks.
By the 6th of December, Malaysia confirmed its first case of the variant. The case was a South African student entering to study at a private university. In Nambia, 18 cases out of 19 positive COVID-19 samples that had been collected between the 11th and the 26th of November were found to be Omicron, indicating a high level of prevalence in the country. Fiji also confirmed 2 positive cases of the variant. They traveled from Nigeria, arriving in Fiji on November 25th.
On 8 December, WHO announced the variant had been detected in 57 countries.
On the 9th of December, Richard Mihigo, coordinator of the World Health Organization's Immunization and Vaccine Development Program for Africa, announced that Africa accounted for 46% of reported cases of the Omicron variant globally.
On 13 December, the first death of a person with Omicron was reported in the UK.
On the 16th of December, New Zealand confirmed its first case of the Omicron variant, an individual who had traveled from Germany via Dubai.
The first death of a person with Omicron was reported in Germany on 23 December and in Australia on 27 December.
Market reactions. Worry about the potential economic impact of the Omicron variant led to a drop in global markets on the 26th of November, including the worst drop of the Dow Jones Industrial Average in 2021, led by travel-related stocks. The price of Brent crude and West Texas Intermediate oil fell 10% and 11.7% respectively. Cryptocurrency markets were also routed. The South African rand has also hit an all-time low for 2021, trading at over 16 rand to the dollar, losing 6% of its value in November.
In early December 2021, the chairman of the Federal Reserve, Jerome Powell, testified before the U.S. Senate Committee on Banking that the recent rise in COVID-19 cases and the emergence of the Omicron variant pose downside risks to employment and economic activity and increased uncertainty for inflation.
International response. On the 26th of November, the World Health Organization advised countries not to impose new restrictions on travel, instead recommending a risk-based and scientific approach to travel measures. On the same day, the European Centre for Disease Prevention and Control, ECDC, reported modeling indicating that strict travel restrictions would delay the variant's impact on European countries by 2 weeks, possibly allowing countries to prepare for it.
After the WHO announcement on the same day, several countries announced travel bans from Southern Africa in response to the identification of the variant, including the United States, which banned travel from 8 African countries. Although it notably did not ban travel from any European countries, Israel, Canada, or Australia, where cases were also detected at the time the bans were announced. Other countries that also implemented travel bans include Japan, Canada, the European Union, Israel, Australia, the United Kingdom, Singapore, Malaysia, Indonesia, Morocco, and New Zealand.
The Brazilian Health Regulatory Agency recommended flight restrictions regarding the new variant. The state of New York declared a state of emergency ahead of a potential Omicron spike, although no cases had yet been detected in the state or the rest of the United States. On the 27th of November, Switzerland introduced obligatory tests and quarantine for all visitors arriving from countries where the variant was detected, which originally included Belgium and Israel.
In response to the various travel bans, South African Minister of Health Joe Paulo defended his country's handling of the pandemic and said that travel bans went against the norms and standards of the World Health Organization.
Some speculate that travel bans could have a significant impact on South Africa's economy by limiting tourism and could lead to other countries with economies that are reliant on tourism to hide the discovery of new variants of concern. Low vaccine coverage in less developed nations could create opportunities for the emergence of new variants, and these nations also struggle to gain intellectual property to develop and produce vaccines locally. At the same time, inoculation has slowed in South Africa due to vaccine hesitancy and apathy, with only 35% of the population being fully vaccinated as of November 2021.
On 29 November 2021, the WHO warned countries that the variant poses a very high global risk with severe consequences and that they should prepare by accelerating vaccination of high-priority groups and strengthening health systems. WHO Director General Tedros Adhanom described the global situation as dangerous and precarious and called for a new agreement on the handling of pandemics, as the current system disincentivizes countries from alerting others to threats that will inevitably land on their shores. CEPI CEO Richard Hatchett said that the variant fulfilled predictions that transmission of the virus in low vaccination areas would accelerate its evolution.
In preparation for the Omicron variant arriving in the United States, President Joe Biden has stated that the variant is cause for concern, not panic, and reiterated that the government is prepared for the variant and will have it under control. He also stated that large-scale lockdowns similar to the ones in 2020 near the beginning of the pandemic are off the table for now.
In mid-December 2021, multiple Canadian provinces reinstated restrictions on gatherings and events such as sports tournaments and tightened enforcement of proof of vaccination orders. British Columbia expressly prohibited any non-seated organized New Year's Eve event, while Quebec announced a partial lockdown on 20 December, ordering the closure of all bars, casinos, gyms, schools, and theaters, as well as imposing restrictions on the capacity and operating hours of restaurants, and the prohibition of spectators at professional sporting events.
On the 18th of December, the Dutch government announced a hard lockdown for the entire country. Ooh, the spread of Omicron, that story is crazy.
I didn't even know about the Quebec lockdown, and that was like a few days ago.
Right. There's like so much that has happened and is happening around Omicron that just people were not aware of. Good thing there's WikiListen.
Thank God for WikiListen.
This has been the Wikipedia page for the SARS-CoV-2 Omicron Variant, Part 3 of 4. Thanks for listening to WikiListen. To support the show, go to patreon.com/WikiListenPodcast and find us on social media at WikiListen and at Wiki.